Okay, the next topic we're going to discuss is radiation oncology. So there's principles behind radiation therapy. So radiation oncology is one of three principal modalities we use to treat cancer. The other two are chemotherapy and surgery. So radiation therapy treats tumors, and what we try to do is give a dose so that we can kill the cancer. So the dose is prescribed by a radiation oncologist who is a physician specialized in treatment of malignant disease with radiation. Okay, so the principles. What are the treatment goals? Precisely deliver a cancercidal dose of radiation to the tumor, and we want to protect the normal tissues around the tumor. So be able to treat the tumor itself without touching the normal tissue surrounding the tumor. It's complex, it's challenging, and requires a team approach of a radiation oncologist, a physicist, dosimetrist, and a therapist. There's a nurse usually there also. So the radiation oncologist prescribes the quantity of radiation and determines the anatomic region to be treated. The physicist calibrates and maintains the radiation producing equipment and helps doctors with dose calculations. The dosimetrist devises a plan for delivery of the treatments to best kill the tumor and protect normal tissues. And the radiation therapist obtains images that localize the treatment area, administers the treatments, records the dose delivered each day, and monitors the patient's physical and emotional well-being. And sometimes a nurse handles that also. So, common treatment uses a combination of radiation therapy with chemotherapy. Sometimes they use both, sometimes it's just one. Radiation therapy can be used to cure the disease or just palliative care, which means keep the patient out of pain. Some of the spinal tumors can really be painful. So fractionation. So what happens with fractionation is we deliver small doses daily until the entire treatment dose is reached. So what that does is it reduces toxic effects of radiation, so the body is able to heal in between. So you don't just give a full body dose of a really high dose, which would make the patient very, very sick if not kill them. Instead, we give it in small portions every day. All right, so in 1896, their first breast cancer was treated. In 1902, first reported curative treatment was performed. And by 1909, Dr. Skinner declared his patient was free of disease and considered cured. So that's pretty cool. The specialty evolved through more sophisticated equipment and a better understanding of radiation and its effects, recognition of time-dose relationships, so that's that fractionated and what the body can tolerate, and a number of other breakthroughs such as computers and being able to do models so that and ways to keep the patient refrain from moving. Okay, so cancer, a disease process that involves unregulated, uncontrolled replication of cells, abnormal cell growth without regard to normal tissue. They invade normal tissue and spread to other sites via blood or lymph nodes, and we call that metastasis. It usually goes to the liver or the lungs. It can go to the brain. It can go throughout the whole body, but usually the liver filters out toxins, so liver mets is very common, so is lung mets. More than 1 million people are diagnosed with cancer every year. Holy smokes. More common in persons over the age of 55. So in men, we have prostate, lung, and colorectal, where in women, we have breast, lung, and colorectal. So lung cancer is the most common cause of death in men and women. So cancer is only second to heart disease as a cause of death in the United States. Cancer risk factors: smoking, exposure to chemicals, viruses, radiation, obesity, lack of physical activity, poor nutrition, and internal factors are hereditary and genetic mutations. So the biological effectiveness of ionizing radiation in living tissues dependent partially on the amount of energy that is deposited within the tissue and partially on the condition of the biological system. So energy effects is described as linear energy transfer and relative biological effectiveness. So the linear energy transfer increase equals the biological effectiveness increase. So state of biological system is based on the law of Bergoni and Trubert. So the radiosensitivity of cells depends on 1, cell differentiation, 2, the mitotic rate, and 3, the length of time in mitosis. So tumors that are radiosensitive, so there's different levels of it. So there's very radiosensitive, there's moderately radiosensitive, and a relatively radioresistant. So we're going to talk about radiosensitive tumors are gonadal or germ cell tumors, lymphomas, and embryonal tumors. So moderately radiosensitive are epithelial and glandular tumors. So radioresistant tumors are sarcoma of the bone and connective tissues and nerve tumors. So nerve sheath tumors, gliomas, etc. All right, so technical aspects. 2 major categories for the application of radiation for cancer treatment. So there's external beam therapy and brachytherapy. And with external beam therapy, the patient lies underneath a machine that emits radiation or generates a beam of x-rays, also called teleradiotherapy or long distance treatment. Most patients with cancer are treated in this fashion. So technical aspects. So 120 kVp X-ray unit for superficial treatments, 250 kVp orthovoltage X-ray units for moderately superficial. There's Gamma Knife, which uses cobalt-60 gamma ray source with an average energy of 1.25 MeV. So linear accelerator is 6 MV to 35 MV. So there's Proton Therapy, Tomo Therapy, and Cyberknife. We're going to touch on each one of those just a little bit. The linear accelerator. So it customizes high energy x-rays to conform to a tumor's shape and destroy cancer cells while sparing surrounding normal tissue. So microwave technology to accelerate electrons. These electrons collide with heavy metal target to produce high energy x-rays. These x-rays are shaped to exit the machine to conform to the shape of the patient's tumor. So they have a bunch of huge blocks that they put in to absorb the ones to help protect the normal tissues. So, radiation oncology or therapy, here is a linear accelerator. That's what it looks like. So here is the patient laying on the table, and here's the linear accelerator. Here's another side cut piece of it there for you to see it. This is pretty normal. This is what we see often. Proton therapy. So protons at a higher dose of radiation can control and manage cancer. This is done with reducing damage to healthy tissue and vital organs. The advantage over conventional radiation. So energy distribution of photons can be directed and deposited in tissue volumes designated by the physician in 3D pattern from each beam used. Therefore, greater control and precision and superior management of treatment. So proton therapy. This is what it looks like in the room. So you have this huge piece here and you lay on a table to be treated, and this gives you an idea how large a proton therapy unit is. So the patient slides out and is suspended there. Gamma knife, also called stereotactic radiosurgery, is very precise, highly focused gamma rays to treat small, medium-sized lesions, usually in the brain. No knives, no surgeries involved. You were put in a head frame, and the tumor lesion locating, we use CT or MRI to locate those and find exact quadrants for them or measurements for them to radiate. And then they do dose planning and treatment. So here, in MRI, they would screw this right into the patient's skull there in MRI. It was a little crazy. First time I saw it, I was not sure what was happening. So then we'd scan the patient with this frame on, and they'd go have their treatment. They come back the next day, and we'd scan them to see the results of the treatment. So here they are in the machine. Pretty cool. And here is a single lung met to the brain, and here it's treated after gamma knife 4 months later. So awesome. Cyberknife is pretty much taking over Gamma Knife, so it's non-invasive alternative to surgery, treating cancers with non-cancerous tumors anywhere in the body. So it's frameless to Gamma Knife and precise dose that destroys tumors and cells sparing surrounding tissue. So it's better than the Gamma Knife, Cyberknife. So as you can see here, it's definitely coming from different angles and treats tumors within the brain. There's Tomo Therapy, so it combines an advanced form of intense modulated radiation therapy, so IMMR, with the accuracy of computed tomography in one machine. It's precise radiation beams to treat hard-to-reach tumors, reduces radiation exposure to healthy tissues, considered slice therapy, Tomo Therapy, slice therapy. And this is the planning of the Tomo Therapy on how they're going to do the treatments. Here is brachytherapy. So it's a radioactive materials placed within the patient. So it's sealed radioactive isotopes placed in tissues into the body cavity or into a body surface. So it's good for superficial cancers and localized primary cancer tumors. So this is prostate seed implants here. It's brachytherapy. So you can see they're going in. Here's your pelvic rim and your pubis symphysis. They have these long rods with the seeds on the end. And this is after they deploy the seeds. This is within the prostate. So it's radiating from within the body. Not so common anymore. My girlfriend did have brachytherapy for her ovarian cancer. So they went in with a tube and left the tube external out of the body. And there's radioactive seeds that they put to treat the ovarian cancer to shrink it. So steps in radiation oncology. So there's simulation, dosimetry, and treatment. So simulation, you have the patient lay on a flat board in CT. CT usually has a curved table. So we put this piece of plastic on top of it or a wood board. We use plastic or wood as they don't attenuate the x-rays, which is great. And we have the patient lay within their mold. So let me show you what the mold looks like. I thought I had a mold there. So there's a mold. So we have them lay on the table in their mold and we scan them. So it's very precise on how we do this. And so for breast cancer, they have these little molds that they lay within and their arm goes up over their head. And you have the planning. So they're going to measure the area that they're going to be radiating and the effects of the tissues all around. And here's part of the planning, dosimetrist. So they calculate exactly how much and where. So this is treating, looks like the facial bones. So something up in the face. And here, so this would be a lymphoma or a lung cancer we're treating here, big old gomer. So as you can see in the path is the heart, so the right atrium of the heart. So they're trying to reduce the dose to the heart. Here is breast cancer planning for radiation. So I talked about that mold that was on that one slice. So this is the mold. So they lay within the mold in the exact same spot. And we scan them in that spot. And then they have their radiation in that mold in the same exact position every single time. And yes, they do patient prep on animals too. So they do radiation. When my dog had a sarcoma, they wanted to do radiation therapy on her every day. I said, you're out of your mind if you think you're knocking my dog out every day for 6 weeks. So people do this. It's a huge business for veterinary and for humans. So it's for all living species. And then they actually do the treatment where they administer the dose to the patient. So you have to line up everything perfectly. So sometimes instead of using these little tags, we will go ahead and tattoo on the patient's skin so that we line up the patient exactly the same every single time. I'm not one who is really good at doing this. It drove me crazy trying to get everything lined up because you move a millimeter and you knock one of the lines out. So, oh my gosh, it drove me crazy. So if you have patience and you're very meticulous, this is the job for you. All right, so as you can see all the laser beams, so we lined up the patient exact and are administering the dose. So clinical applications, it's good for lung cancer, prostate cancer, head and neck cancer, cervical cancer, Hodgkin's lymphoma, breast cancer, laryngeal cancer, skin cancers, and medulloblastomas. Okay, future trends. So, intensity modulated radiation therapy, IMRT. The newest is the volume modulated arc therapy, so VMAT. So as you can see here, it spins around the patient and does this whole 3D, very cool, 360. Anyway, so that's what's coming up on the market. It's been a couple years since I've done this slide, and it's still not out yet, but definitely cool. And yes, you can beat cancer. All right, so that's your radiation therapy lecture.